So hello to all the viewers. With me, I have a champion performer, Dr. Archita, who has scored an amazing rank of 33 in the NEET SS medical group entrance exam. So this was an exam full of uncertainties, right from the exam pattern, the type of questions, will it be factual, will it be clinical? I think it was definitely taking a toll on even the mental health of many of the candidates preparing for the exam. But amidst all these uncertainties, getting a national rank of 33, hats off to your determination, Dr. Archita.
Thank you, sir. Thank you so much, sir.
So yesterday, when the results came and you saw rank 33, what was the first response?
I rechecked my rank multiple times.
Okay.
Had many people check my rank a lot of times at different intervals because it was unbelievably good.
Okay.
I hadn't expected such a good rank.
Yeah, because this rank is not just for one specialty. Like all the people of the country appearing for like wanting to go for a cardio, neuro, nephro, gastro, everyone is giving this exam. Even for a single specialty exam, a rank of 33 is outstanding. So you can just think of the gravity of your achievement of getting this huge rank of 33. Okay. So Archita, definitely the viewers would want to know more from you. First of all, starting with your background, like from where are you and your MBBS and MD days from which colleges?
So I'm originally from Delhi. I did my MBBS from Armed Forces Medical College, Pune. And then I did my MD from Dr. Sampoon Anand Medical College from Jodhpur. Okay. I passed out this June. I completed my tenure.
All right. Okay. So once you passed out, were you realistically expecting, okay, you're going to be one of the toppers in the medical group exam?
No, sir, not at all. I was actually prepared to take a drop also because I didn't want to compromise on a good college this time. Yeah. I think the general medicine pattern played in my favor.
But what will you tell your juniors? Like you've just done your MD and see, what are the key take-home points that your juniors should know about preparation for your SS medical group exam?
So I think the important thing is to focus on the important topics. Like the miscellaneous topics are frequently repeated, like acid base. It had like 3-4 questions this time also. Then the basic concept should be correct. Like a lot of questions you can answer just on your basic knowledge of the common topics that you see in your patients also. So if you read them properly over the tenure of 3 years, I think your preparation in the last 1 month becomes much easier. Okay. Plus, at the end, you need something consolidated. So if you make your own notes, it's good. Otherwise, you need a platform that can give you something which is more ready-made, because that's what I use because I don't make my own notes mostly.
Okay. All right. So just take us through your journey in DocTutorials. When did you join DocTutorials?
So last year, I took the Qbank series, which I mostly solved during my night shifts in the emergencies.
Okay.
Like a few questions per shift. So okay. I did not complete it much. In July end, after the prospectus came, I started preparing for NEET, and that's when I came to know about the QRP. So I took the video pack during that time. So that was like very helpful because it gave me a schedule. Before the QRP, for 5 odd days, I did not know what to read, where to read. I was randomly reading some tables of Harrison's. So after QRP, since it was like 3 days, I would watch the QRP session. Then I would see some videos or read the notes attached to those videos as much as I could in those 3 days and maybe solve some question bank. And then I would give the test. And in the test, I would find out what are the topics that I'm weak in. And then I would give half a day to revise those topics in detail. So that was helpful, sir.
So basically what you're trying to tell is that towards the later part of your preparation, the QRP gave you a direction. It's like the last minute sprint in a race. Yes, many times what happens is, since our subject is very vast, the consolidation and the revision is the difficult one. Yes, because see, if you're given 1 month left for revising, the time you're reading cardio, you might feel that, okay, you do not know these topics, you want to prolong reading that. So it's difficult to give yourself a timetable and stick to it. But since you had the QRP sessions, I think you definitely had targets. Was your studies in the last couple of months revolving around the quick revision program of DocTutorials?
In the last 1 month, I followed the schedule very sincerely. Like I think I missed one test, but apart from that, I followed the schedule very strictly.
And did you write the exams also that we conducted along with the quick revision program?
Yes, most of them. I think I missed 1 or 2. But apart from that, I wrote.
So how were your approximate ranks in these exams?
So a few tests I got top 10 ranks. Some tests I did not do well. So those subjects I focused on more because I knew that I was weak in them.
So how do you see the level of competition in the exams that you wrote at DocTutorials? Because a good number of students were giving the exams. So to know where you are standing, okay, this is where I'm standing, I need to correct all this. So how did these exams help you?
So more than the ranks, I think it tells you what mistakes. I think the exams are very representative of the NEET level exam. Like there were some very easy questions in DocTutorials as well as some difficult questions, and most of them were mid-range questions. And the NEET pattern was also similar. So I knew what topics to focus on before the exam. And if you get a bad rank, it gives you a little more motivation to study more. And if you get a good rank, then you're like, okay, at least this subject I'm good at. So that way it does help a lot. So.
All right, because that what you said is very important, because it's important to have a good range of preparation for your NEET SS exam, because as you said, even in the current NEET SS, if you look at the questions, there were some questions which were very simple. And for the viewers, see, sometimes what happens is when you are post MD level, sometimes what most troubles you is those very simple questions, because amidst the heat of the exam and you're always expecting a question above a certain level. So when such a question comes, you think, okay, is this really, is this the answer or is it something else? So I think you have got to expect a wide range of questions. So what do you think, having written the exam, the spread of questions, was it a uniform level of toughness? What do you have got to say about the level of toughness of the questions of the medical group?
I think it was a very general paper overall. Like there were questions that I was like, oh, I've read this in NEET PG. Then there were questions I thought that I'd attended during ward rounds or some conference, and some scenarios where I'd seen such patients. Then there were obviously high-level questions that I had read towards the end and factual-based questions. It was more factual-based, I felt, because everyone was expecting a more concept-based pattern this time. But I think it was still an okay mix. Like it wasn't completely factual-based also.
And what do you want to tell your juniors preparing for the upcoming exam, medical group exam? So is Harrison the backbone of preparation? What percentage of questions come from Harrison? And what else should, all these candidates be focusing on?
So I think the most important thing is to build the concepts. Whatever book you use, I think there are so many resources nowadays. Obviously, majority of the questions come from Harrison's. When I checked back the answers of a lot of questions, there were handpicked lines from Harrison's. Like there was a questions that leptospiral nephropathy is uniquely associated with hypomagnesemia.
Same was there in Harrison, line from Harrison.
Exactly the same line. Like you would know the concept even if you haven't read that exact line. But obviously for important topics, it is important to go through Harrison. I think at least 80 to 90% questions would be from Harrison, except maybe the genetics part.
Okay. All right. And you went through the QRP videos also. So how did you find the QRP videos, the quality of videos? Were they actually concise and crisp? Did it save your time?
Yes, so they were very helpful because it is impossible to revise such a voluminous amount at the last moment. So like those 2 hours per session, you could watch them at double speed or like at least 1.5 speed. So you could quickly go through a lot of things. And I made notes of like certain points that I thought were repeated in tests in question banks and the QRP. So I made a notebook that I revised in the last 3 days. Obviously, I revised like just 1/4 of it. But 1-2 questions actually came from that, like during my, so that was also helpful. I think that's a good idea to have some volatile points noted down.
So what is the plan now? Rank 33, where are you going to take? And which branch?
Neurology, sir. Of neurology.
So hopefully, we can meet in some conference as well, a national
yes,
conference.
I really hope so,
there are multiple conferences, and neurology is definitely a fascinating branch. But tell us what actually fascinated you to take neurology?
So I think like in current era of medicine, it's a lot of investigative technology that we're using for every field. But neurology still has certain things that you can just diagnose clinically. Like investigations play a role, but clinical diagnosis is like the first thing and still very important. And I think that really thrills me.
Okay. So all at home are happy. So yes, must be ecstatic after the superb rank, right? Yeah. So very happy for you, Dr. Archita, because just to summarize to the viewers what she actually said over the course of the interview. Again, like most of the toppers, she said Harrison. Harrison is very important. You have to read Harrison. There can be handpicked lines from Harrison, but she said, get your concepts clear. And she said that even while she was practicing MCQs, she would solve all sorts of questions. I have seen some candidates making a mistake just practicing clinical scenario questions alone, anticipating that almost the entire paper will be clinical. See, nobody can predict. Maybe the next paper might be highly oriented towards clinical questions. But I completely agree with Archita that you should have a right balance. You should strike a right balance so that when you go to the exam hall also, you have that confidence. And all candidates, who are using DocTutorials, once you're done with the main videos, go through the quick revision programs. And definitely every year, we are conducting such exams with definite timetables, which will actually help you finish your portions, because I think the preparation towards the end phase actually revolves around consolidating and revising it in a time-bound manner. So one last question, Archita, how many questions did you attempt, and approximately, in fact, you know your score also. So how many questions you got it right?
So I attempted 147 questions.
Okay.
And my score was 461. I didn't calculate the number of rights that I got. I was just happy.
Basically, it goes to show that, see, when you gave the exam, you were aggressive. Because I talked with rank 1, rank 3, both of them attended 150. Most of the toppers go on to attend 145 and above. So I'm sure, at least there were certain questions where you could narrow down to 2 options, but you probably would have taken a chance. But remember, it's not just blind guessing. I think it's educated guesses, because she has practiced so many MCQs. And probably when she's able to narrow down, she might actually think, okay, I think this one could be the answer, right? Okay, Archita, I think, your words were definitely inspirational to the future aspirants of the NEET SS medical group, because see, in a short span of time, you could consolidate points, because many candidates are there. They might think that, okay, even after MD, it might take 1, 2, or 3 attempts, but you have just beautifully told them how to summarize and what probably helped you towards the later part. It's how you consolidated, revised, you wrote the exams. And I think, the last grand test that you gave also had, you said the grand test that you gave in DocTutorials, you had an improving trend of ranks, correct?
Yes, sir.
And what was your rank in the last grand test?
58.
58. So again, 33, I think it's more or less matching, plus or minus 10, 20 is there, matching the results of the DocTutorials exams also. So thanks a lot, Archita. And as I said earlier, let's meet very soon in a conference, and definitely, I'll be getting a party from you. Okay. All right.
Thank you, sir. Thank you so much.
Thank you so much. Bye-bye.